Thanks for coming to this conversation on how to take patient relationship to the next level in 2024. So before I get into the presentation, excuse me, so will this switch at some point? Okay, perfect, excellent. So before we get to the presentation, just a show of hand. So who is in a good personal relationship right now? Yeah? And what does a good personal relationship look like? Can you shout out some of the keywords that will jump at you? I'm sorry? Communication, excellent. Support, okay. Patient, all right, fine. How about it works for both parties involved, right? It's not a one-way street. Yeah. So this is exactly where how we think relationships are in a personal level, but when it comes to digital health, we have a different story, right? It is, we see a lot of engagement rather than relationship management, and what I'm going to talk you through is what does an alternate view look like and what we could do different in 2024. So it's a relatively short agenda, like 3 things. Let's define what patient relationship management is all about. This is a relatively new term that TeleVox has started proposing in the industry, and we'll talk you through like how is that different than patient engagement or alternate models that exist currently, and then what makes TeleVox different. All right, so let's take, again, let's extend the definition that we had around personal relationship management. PRM in a healthcare should look like a long-term personalized relationship with the institution as well as the patient. It should not feel like a one-way street which works for the institution only. Hey, you're due for your appointment. Are you going to come? Yes or no? Or you're due for your colonoscopy. Would you want to book an appointment? Yes or no? But when patients have a question of their own, where do they go, right? Do you ever see that play out in your personal life where one partner in the relationship can talk to the other whenever they feel like, but with the second person, when they want to talk, like you say, if you call me, there'll be a 30-minute hold time, or you can talk to me on the website, but you can't text me back. Like that thing does not work in a personal life, right? So why should this work in a healthcare setup? So we need to raise the bar to get those paradigms working in the healthcare model, right? So this has to be personalized, data-driven, continuous relationship. So it feels like both the patients as well as the healthcare providers, whether that's institution or the staff, are getting the right level of engagement. How we got here is most of the workflows are currently, I'm sorry? All right, okay. So how we got here is most of the workflows are driven with institution or even the clinical workflows in mind. There is a wide variety of people who are trying to reach the patients. There is a care team that's trying to reach the patients around clinical care coordination. There is staff trying to reach out for prior auth or where the referral status is, or there are a couple of other stakeholders trying to reach the same patient. So it feels like an inundation of messages through phone calls, through text messages, through emails, through flyers going out to the patient, and patients don't necessarily get the sense that are they talking to a single brand or are they talking to different solutions active within the different health system. And principally, like this leads to a big reputation risk for your own institution as well, because how do you ensure that patient knows that this is a trusted and a reliable communication that's coming from your brand as opposed to a generic phishing happening over email or SMS, right? So it should feel like a continuous and a single pane of a glass of experience, which is what TeleVox has been proposing and has implemented through our customer base over the last couple of years. So if you think of it, put patient as the center, the blue circle around the patient is the patient relationship management layer, right? This is what ensures that every message, every interaction that goes to the patient goes through with the right fidelity around brand, around reliability, as well as from availability point of view as well. And even when the patient wants to reach back, they should not necessarily know, I need to call this phone number to book an appointment, or I should go to this website to get a prescription refill, or I should send this message through my care team using this different portal, right? It should not be a choice on their part. It should not be a disconnected, disjointed experience. It should feel like I'm going to talk to whoever I need to talk to the channel that works for me, as opposed to a channel that works for the care team or the institution that is at scale. So this is what TeleVox has been proposing, and this is what patient relationship management should feel like: a single pane of experience, irrespective of who you're talking to, what you need to talk to about, and whenever you need to talk to. So how is this different than the patient relation from the existing current models? But let's just talk about the problems at hand. Like, these are just some of the problems that you might see in your own life as well. A large number of patients say they will delay care if they don't get the right engagement with the provider. It could be because of the pain in getting somebody on a phone call, or it says that they don't prefer a phone call, or they left a message, multiple phone tags back and forth. So there is a significant amount of patients who will delay care, and that is an expensive affair for the healthcare industry overall. Overall, engaged patients are a lot more inexpensive to maintain over the course of the same. So as we are looking into value-based care, more patients are engaged with our solutions, our products. We find them easier to maintain, the better outcomes, better operational and clinical outcomes all around, right? And a significant percent of patients, when they leave the four walls of a visit, you get handed 10, 20, 30 sheets of paper, and you don't necessarily know okay, what exactly am I going to do next, right? So where do you go? Should you find the last printout that's still sitting in a car or a file or a folder somewhere? Or can you just ask the same question, hey, what was I supposed to do today because I just got discharged from a hospital, right? So these are just some of the big opportunities that we see in the current model. And how we got here is because we have two outdated models currently at play. First is patient engagement, which is treat a message as a one-way street from an institution to the patients. Again, the example of you have an appointment in 3 days, are you going to come, yes or no? You're due for your colonoscopy, call this phone number to reach out to us, or here's a printed flyer on a wellness campaign that we are running. But these are all institution driven. They don't necessarily counter for the fact that the patient might have questions of their own as well. So you're sitting in watching a movie, an ad comes up, and you're does this apply to me? Where do you go? The answer should not be Google, because you will get anonymous and unbranded information. They should feel the seamless connection without the burden of a phone call or a patient portal or a complicated login ID password to have that conversation with you without burdening your staff, whether it's clinical or operational, right? Let's talk the EHR-driven engagement. There are a couple of big points here that I would stress. First is the notion of a digital divide, right? Almost every single one of you has invested a lot of time in activating patients on the patient portal, but the percentage of patients who actually use the patient portal before an appointment or after the appointment is done is in maybe 20s or 30s, right? It's not a significant portion, right? So, and even as you implement more and more features in your mobile app or the patient portal, you are only serving the patients who already have access to those solutions. How do you ensure that the overall engagement with your entire portfolio of solution goes from 20 to 30 up to 80s or 90s, right? Building more in the same portal is not going to get us there, right? That is essentially what digital divide is all about. Most of the workflows are built with clinical perspective as opposed to the patient. Right? So again, the relationship scenario, what happens when patient has a question of their own, or they need to do a prescription refill, or they need, how are my lab results compared to 12 months ago, and how do I compare to other people in my demographics, right? Current option for these patients is to leave a message to the care team or make a phone call, and all of them are less than optimal, not only for patients, but more for your own staff as well, right? These are the perspectives that we have to change. We have to think from a patient point of view as well, without burdening your clinical or operational staff. And the last point that I will stress is EMRs were generally built for system of record. They are meant to help with the billing, right? This visit is this complicated, this should justify this level of cost. It's meant for legal, medical purposes. It was never meant to be the system of record. It will be like retrofitting an old car with a new EV engine and expecting it to work the same way. the design and the chassis is just like not quite right. We will not get the same experience. So this is what is essentially how PRM is different than the existing models, like how patient relationship management is different than patient engagement, and how it is different from EHR-driven engagement. So what does TeleVox do? So before we get into that, let's just talk about like what TeleVox is. So I don't know if you are existing customers or not. As a company, we've been around for like 30 odd years. We serve a significant number of health institutions in United States, with a significant number being large institutions which are enterprise grade, Epic or Cerner customers. Our solutions, and I will get into like this later, are broken down into digital front door, which is around getting more patients to book an appointment, appointment management, which is geared towards getting more patients be better prepared for their appointments, so there are no last minute surprises, and then care program for chronic care management and patient marketing for patient acquisition. So we solve problems related to awareness, for access to care, for visit preparedness, through the whole gamut. We are not a point solution that does only ABC. It is a platform that serves the patients throughout the care journey through multiple channels, web, voice, and SMS. And we leverage automation, we leverage Inform wherever needed, and if they don't work, we leverage connecting the patient to the staff member, so every interaction goes connected as opposed to falling on a dead end. And through this portfolio, we drive a clear ROI, which is around higher operational efficiency, better patient experience, and at the end of the day, higher revenue. So I hit on this as a credibility. This is essentially gets into why we are in a position to talk about patient relationship management. We've been doing this for a long time. We've been doing this for 30 odd years, and the 7,000 institutions, 1.5 billion notifications, more importantly 90 million patients that we've interacted with. So that has given us a preview into what the patient preferences are. Who prefers texting, who prefers phone call, who would rather still prefer the warm voice of another human on the other call. So you just can't digitize every single scenario and expect that one single digital experience will work for everyone. A true omni-channel experience that's accessible needs to work. Now, specifically, how this comes together is, here's an example of how we convert engagement to the relationship. What you see on the left side is a traditional engagement model where the patient gets a reminder, they confirm that appointment, and then life happens, whether something personal or a professional conflict comes up, and they need to reschedule that appointment. What happens currently is you expect the patient to call, stay on hold for 20-30 minutes, or the worst case scenario, the patient doesn't show up at all because they don't want to make a phone call. Right? That is not convenient, it is not efficient. What we do it is converting, remove the SMS as being a notification and a fixed responses, convert that into a smart SMS. And this is just one of the examples what TeleVox provides, how we are differentiated, which is make SMS persistent, actionable, conversational. It's a two-way self-service channel as opposed to a one-way engagement or a notification channel. And what you see on the right side is an example of the same patient who confirmed their appointment, but now they have a follow-up question. Whether that is, I need to reschedule an appointment, just do it over SMS. You don't need to figure out which phone number to call or where to go. Use the same channel that the business, in this case the institution, used to communicate the patient. Make it a two-way dialogue, right? And that's where we will see a more continuous engagement throughout the care journey. And this example is just for appointment management. This could have extended to, can I bring my therapy dog for an appointment? My family member is going to be admitted to the hospital. What are my meal plans, options? None of this is scripted. The inherent design of an SMS forces us to remove the UI clutter around. There are no pre-filled boxes that you can only pick this button or that button. It's an open-ended conversation, and the experience escalates to handle any single interaction that the patient could throw your way. Okay, and so just to recap, this is how, again, we are not a point solution, we are not a reminders company, we are not a care programs company, we are not a web virtual agent company. Our entire platform comes together to serve the patient's need, irrespective of where they are in the patient journey, with clear value propositions for you as the institution who's paying for the services, but also the patients who you are serving, so everyone gets something that's most important to them, and it is a single pane of experience that works for the patients on day one. Now, that said, our platform is not a monolithic solution. It's not all or nothing. You don't have to deploy everything in one shot that takes 3 years to roll out and $10 million, none of that. You can choose your own starting point. If you are comfortable with web solution, great. If you want to go value-based care and chronic care management, absolutely, we can, that can be a starting point. If you don't like our care programs that we provide out of the box for you and you want to customize this for your specific preferences, whether that's patient or clinical, absolutely. This is how the platform provides day one value, but it's still customizable for your future needs going forward. So in conclusion, if there are 3 things I want you to walk away with, what is patient relationship management? It's principally a patient-centric workflow design. Think of the patient side of the conversation first. What happens when patients have their questions? Where do they go? Is it instinctively obvious to them where should they go? So build a solution that works in that scenario. It's about a longitudinal relationship, whether you are in a discovery phase or preparing for an appointment or post-visit follow-up. It works in every single scenario, as opposed to it only helps you book an appointment but doesn't help you prepare for an appointment or doesn't help you stay healthy after your appointment is done. And it is principally personalization at scale. A CHF patient compared to a new expecting mother who's been diagnosed with diabetes will get different treatment altogether, different guidance throughout the journey, and that's what personalization at scale is. It's not just doing single experiences. And how is it different than other models? It is always connected, always on, persistent, actionable, conversational at every step of the way, built with patient in mind, without compromising your staff burnout concerns or your efficiency. And what does TeleVox help? It's principally think of this as a truly omni-channel solution. It's a portfolio of solutions that work very well together, but they can integrate and extend to your specific needs. And one last thing to remember, it's about persistent, actionable, conversational design as opposed to one-way single notifications.